Good evening, everybody. All around the world, all my friends out there. I wanted to properly address everybody here. I spoke with quite a bit of you all in the Eustachian Tube Dysfunction group. Some private messages and then also some public messages. And so I wanted to really address everybody here. I'm very, very proud of everybody staying consistent and staying diligent on getting rid of this thing. I can't express how important this is that we all stick together so we can really get through this, because this is not going to be, and it has not been easy for any of you. And so I wanted to just do a video here, and I also jotted down some questions that I wanted to address, that I just feel like a video is so much easier to let me see, I think, yeah, I got my got my device here. I carry it everywhere in the house, of course. If I do my little sessions, I bring it with me. So some of the questions that I got, and I wanted to address those via video here, and I'll kind of get through those. And so I wanted to, let me just get myself set up here. I'm getting a lot of questions about this device here. So one of the questions that I'm getting quite often is that people are asking me, how are you set up on this thing? Like, do you do to the side? Do you do to the front of your face? I kind of tell everybody, it's totally free to do how you feel. To really direct it, it's good if you want to put it to the side and let it hit the side of your ear. So I did that quite a bit. So I would do it. So if I had it set up here on the table, I would just sit back, be on my computer, or listen to music, or watch something, and let it just shine on one side of the ear. It has the 15. I don't have it plugged in, but it has the 15-minute auto shut off. So you're free to kind of move around a little bit, but for purposes of targeting the area, you can put it on the side of your face here, so you can get in that ear or whichever ear it is. So that's one of the questions I get is, do you aim it to the side? Do you aim it in front? I just kind of rotate. Right now I don't do it as often now, but when I do it, I do a lot of therapy on the back and the shoulders and whatnot to keep. See, the thing about it is, let me kind of go over a few things. See, the thing about it is, we carry a lot of stress in our shoulders, a lot. And so what happens is, we're putting a lot of stress, and sometimes what we're doing is we're raising our shoulders up a lot. And what that can do is put a lot of stress on the neck, going down up to the jaw, really inflaming the area here. And what's happening is that, so there's a point in the back of your neck here, is your axis, right? It's right above, I would say, the base of the skull. It's kind of where, when you kind of press on this area here, it goes inward. It's kind of the soft spot. If you press on that area and kind of turn, you'll feel the movement here. What makes this issue complicated is that it's a combination of your shoulders, your neck, your jaw, all into one in the base of your skull. The problem is that if you're carrying stress in this area, from the neck to the shoulders, even to the back and to the shoulder blades, you can put excessive stress in that area of the jaw, because they're all connected. They're like kind of interlocked together. And so what's happening is that if you're dealing with Eustachian tube dysfunction, it can be a muscular issue, it can be a nerve issue, it can be a issue with fluid, it can be an issue with many different things. If you're a person that's on your computer and you tend to raise your shoulders while you're typing, you're putting excessive stress on the muscles here. And so a lot of the times, if you're doing that constantly, some people did ask me, well, how did that, I have bilateral issues, and that can trigger many different things. If you're having issues with Eustachian tube dysfunction, and I'll get into that a little bit more, this condition is not it's not literal. It's not very easily identifiable. Basically, is you hit your head, you have a knot, that's what happened. It's not like that with this condition. It could be something that's called referred, not really pain, but kind of like referred annoyance in this sense. For me, it was a lot of clenching. I had to train myself, by the way. I train myself to stop clenching so much. At night, you can't see it, but I would be putting a lot of stress on the back, the joints here in the back of the jaw muscle. And so, where's your eustachian tube located? It's in this area, right? It's right in here. And so, if you're putting excessive stress in that area, you're going to cause inflammation. You're putting inflammation turns into pain. It turns into discomfort, tension. It's all related. The beauty of the red light therapy is that this is what this heals that issue. It heals the fact that, in a sense, that if you have targeted inflammation in certain areas, you can shine the light on there and it can start to help get better blood circulation focused into that area. It's been used many years. It's not new technology. It's been around for many years. But the problem is that we're not educated enough on it, and we're not told that we could use this for this issue or we could use it for that issue. A lot of times you see spa and treatment centers using it for muscular problems and issues with targeted pain in the back and in the neck. And then, it's even, if you even go to Amazon or anywhere and you type in red light therapy hair growth, there is a cap that literally it's basically just basically a cap with red light bulbs inside the cap. It's like almost $600. It's incredible. You put it on your head. It's supposed to help with hair regrowth. All it is red light. That's all it is, essentially. And it's $600. Anyways, what I'm saying is that this light heals. It helps. But what I also want to emphasize is that you can't just sit in front of the light. My friends out there, I wish it was that easy. I wish I had I wish I had the ability to help all of you quickly and pain free. But unfortunately, the light is going to target that area, which in this sense our ear. But then there's other things that have to kind of come in conjunction with that. You have to also be sure that you don't have food sensitivity. So a lot of you out there have done your homework already. This isn't new thing. This isn't just, I've been reading a lot of the comments. Some of them I respond to. Most of them I try to respond to. There's a lot coming through, so I really try to respond to as many as possible throughout the day. But you folks have done your work and you're tired of it now, and I totally understand. And so the thing about it is, you have to also, if you haven't done this part of the work yet, is you have to see if you have a food allergy. A lot of you have probably done that. You have to see if there's any sensitivities with dairy, if there's sensitivities with high sodium intake, if sensitivities with gluten. And so there's different things that could be making it worse, but I will tell you still, I will say that this device is going to help no matter what. So you continue to keep doing it, but at the same time you can't expect miraculous results. Some people on our group have experienced miraculous results. They may have already done their homework, or their condition may have not been as chronic. But if you're dealing with 10 plus years, 5 plus years, 2 plus years, you're going to need to do some unwinding, and that's okay. That's why we're here as a group, to help each other unwind back to optimal health, or at least manageable health. Another thing I want to address is a lot of you have experienced and spoken to me about dizziness, and it's very normal. If you obstruct the flow of the eustachian tube, your eustachian tube is controlling a lot of your balance. And what the problem is something called your middle ear. It balances it. Let me put it this way. There's something called your equilibrium. I brought that up a few times. And if you have an obstruction in the ear, and your other ear is functioning perfectly fine, as you start to move around, you start feeling a little, whoa. It's like when you go swimming and you get water in your ear and you feel a little lightheaded and a little off balance. Your ears control a lot of the mechanics of the body. It's really complicated when you think about it, but your whole head region is very complicated as it is. So if you have an obstruction in the ear and you're feeling dizzy and off balance, that's normal. That's what's going to happen when your ear isn't centered. Your middle ear has been impacted with inflammation, and it's been impacted with congestion and many other things that cause the ear to come all out of whack. So dizziness is one of the other questions that I come across, and so I just really want to let you know that the red light therapy is going to help. Look at it as a way to supplement other things you need to be doing, because we don't really know. The reason why I can't just tell you red light therapy is going to solve your problem is because we're still trying to figure out what kind of Eustachian tube dysfunction you have. It's not like a sprained ankle where it could be high ankle sprain, it could be low ankle sprain, it can be, you know, there's different variables, but all in all, you'll be able to figure out what it is. With this Eustachian tube, you really can't do that. You can't tell right away what it is. So I want you all to know that I will back this up forever, because I know what did it. I know it took work too. It was the combination of the red light with making dietary changes. And someone asked, what were your dietary changes? Well, I try to tell everybody the same, and I try to remember to tell everybody without repeating myself. I told everybody the same. I got the caffeine out of my diet. I had to. It wasn't helping. If something's not helping, why keep doing it? And also, dairy just wasn't good for me. It just wasn't helping me, so I had to get rid of it. You know what things are not helping. As you age, we all age, we know what's not working, what's helping. And I also drunk a lot of this. And I know it sounds funny. I did a video and it sounds very basic and elementary, but we go too many hours without drinking water. Too many hours. You know, it's way too much. We have to keep this going so we can keep things moving. So those, in brief, those are some of the things that I did, along with stretching and listening to very good music, sound waves, and meditation, and those things were very beneficial to me. Now here's the big thing that I want to throw at you here, that a lot of you were surprised. Dental work, dental issues. It's a big deal. And the problem is that when you go in to have your teeth examined or cleaned or root canal this or cavities need to be addressed, that the problem is that most dentists won't dive down that area with you. If you ask them about if this dental work gonna help me with this, I have been told by a dentist it should help get rid of some of your ear problems, and then that was it. It was just, I actually got one dentist to tell me, you may have a problem in your teeth. We get rid of the abscess, clear up the infection. This might cause an issue with your ear. So I dug a little deeper. It certainly was. So I'm telling you from a dentist's mouth, after I did the research. See, the thing about it is when you do the research, you have the power to ask the question. Had I not done research prior to going to the dentist, I would have never asked them that question, because some people say, what does dental work have to do with me having ear problems? It's there, folks. It's a problem. If you have an infection back here, places where your brush just don't go very well, that infection moves. It gets into the bloodstream. It can cause numerous problems. There's been studies out that your dental health can affect your heart. I mean, it's a big deal. So I will tell you, start, if you're in a place where you're like in that place where I don't know where to start place, start with your dental work. Of course, I always say the red light therapy, but start with, you want to get multiple things rolling. Again, I'm going to tell you, I have no connection with this company. I'm not even sure if it's, I know they sell it in the US, but I'm not sure where it originated from. Maybe Germany, I'm not sure. But I want you to start with those basics, because again, if you're doing the most highly, let's just say, it's just not going to be good. If you're going to be disappointed if you do something extravagant that doesn't work. So start minimally and then work your way up if that is what it takes. But I'm pretty confident. Ask your dentist. Push them a little bit. Sometimes you have to, with these medical professionals, dentists, doctors, ENTs, they all sometimes you have to like push the issue a little bit. Because you know they're going to be surprised when you start asking these questions, and it's unfortunate that a person in complete confusion has to go in there and defend themselves and try to figure out what's going on. But I was in there and I was like, look, I am paying you to do this job, and I am paying with my insurance's help, of course, but I'm working for it. I need answers, and I need to keep asking you stuff until I feel like I've asked everything out. You need to ask them questions. That's what they get paid for. They go to school for this stuff. Don't just go in there and let them do things and then you leave and you're confused and then you have to get on Google and figure it out. I will always tell you to do your research, but you need to have some back knowledge to ask the question, to feel confident in what their answers are. Because if you're not pleased with their answers, then ask another question. They're paid to answer your questions. So keep that in mind, folks. Your dental work could be a problem, and if you have wisdom teeth coming in, or they've already most likely already came in, that could be doing things too. So think about that. It could be dental related, and that could be a really easy fix compared to many other things I'm sure you all have tried and attempted. So I've already talked you guys' ears off for 16 minutes or more. I really would love to hear you guys' questions. Come back on this. That was just a short video of what I plan to do. I plan on doing bigger videos, longer videos, more live interactive videos about this condition. I'm not letting this one rest till we get more people healed, more people feeling better and confident about where to go next, because there's a lot of people in this Eustachian Tube group that are struggling every day, and it's keeping them up. Even there's parents on here with kids keeping them up, you know, trying to figure out what this is. So I will love to be all of you guys' advocate to figure out how to get this resolved. But in the meantime, I'm going to keep doing my research, doing my reading, which I do all the time. So you can count on me, is what I'm saying. So I want to go ahead and close that on a positive note. If you have any questions, any of you, please drop them down here in the comment section, as well as you can find me on Eustachian Tube Dysfunction Facebook group. Just search Eustachian Tube Dysfunction. I'm probably on there somewhere. Leave me a message via Facebook. I usually respond on there. There's a lot of ways to get through where I'm at. You can also find me on Instagram, Sir J Monty. I can throw it on the screen. And yeah, I really hope to hear from you all, and I hope you have more questions, because I am here and happy to answer them. Take care, everybody. Signing out.